Okay, so welcome everyone. Thank you for joining our discussion today. Confidence or hesitancy, COVID-19 vaccinations in Eastern North Carolina and what's ahead. I appreciate everyone from joining, whether you're joining live with us right now or you're watching the playback via Facebook or YouTube or whatever platform you found it. I want to emphasize that whatever method you're joining us today, that I do want this to truly be a discussion and a conversation. So if you are joining us via Zoom today, make sure you use the Q&A tab to ask any questions, provide comments, provide us with compliments. We'll take those too. No negativity today, but we'll take those three. And if you are joining us via Facebook or YouTube, please do still comment and ask questions there. I will be checking both of those platforms following the event, and we'll be replying. And if I myself do not have the answer to a question, then I will make sure I'll filter it to the appropriate panelists and we'll get you a response. So I am going to start off by just providing a quick introduction of myself. My name is Kimberly Bellamy. I'm going to serve as your moderator for tonight. I am from Eastern North Carolina, born in Rocky Mount, North Carolina, and raised in Tarboro, North Carolina. So I'm a true 252 girl through and through. And I was interested in bringing everyone together for this discussion because it's very personal to me for a number of different reasons. One being, I have been afforded the privilege to work at a medical association. I'm not going to specifically say the name of the association because I don't want people to get confused and think that this event is tied to my place of employment. But because of my connection to my position, I've been able to get real-time information about COVID-19, about the rollout of the vaccination. And honestly, what that allowed me to do is make an informed decision about whether or not I myself was going to get the vaccination. In full transparency, I myself had COVID-19 this past summer in late July, early August. Even with me doing social distancing, barely leaving my apartment, doing grocery delivery, I still somehow contracted COVID-19. And thankfully, I was able to recover from that. But even with me experiencing COVID-19, I still had some hesitation related to the vaccine. And I think a lot of that was just due to me having a lack of information at the time. But as I said, because I've been afforded the opportunity to work at a medical association that's done a great job of answering our questions related to this, I was able to make an informed decision based off factual information, accurate information, and go from there. So I'm proud to announce that I'll be getting my second dose tomorrow. So fingers crossed I will have no related symptoms there, but I truly want tonight to be about what I talked about, knowledge building, increasing our awareness around this, not only around the vaccination, but also for those who are saying, I'm still not interested in getting the vaccine, how exactly do we navigate post the world of the pandemic and COVID? And I feel like this discussion is very timely for so many reasons. We had some new recommendations come out from the CDC today around mask wearing and gatherings and those types of things. North Carolina is set to reopen many different things on June 1st. So I think we're gonna have a fruitful conversation tonight. I by no means am any expert on this topic. I just really wanted to have this discussion with my home community. But I do have a great group of speakers lined up for you today who are well-versed in the world of healthcare, as well as just providing support in different aspects of the community. So I am going to allow each one of them to do a short introduction of themselves, their roles, and their connection to this topic. And I will start with LaShawn Jenkins, because he is the first person I see right now.
Thanks, Ms. Bellamy. Hello, everyone. My name is LaShawn Jenkins, and I am currently in the educational field. I have worked in Edgecombe County Public Schools for the past 20 years. I currently serve as the assistant principal here at Tarboro High School. And honestly, my interest in this conversation, my interest in participating in this conversation or panel discussion is personal for me. In April 30th, 2020, I lost a brother to COVID-19. And so very early in the game, before we knew it was going to be a pandemic, it was personal to me. And so I'm just humbled to be part of this conversation. And I hope that I can bring some insight from the platform in which I sit. Thank you.
And now I have Ms. Corbett introduce herself.
Hi, I'm Robin Webb Corbett. I'm also a resident of Edgecombe County, a lifelong resident. I've had the pleasure of working at Edgecombe County Health Department in the past and working with some of our fine providers as Dr. Coward over the many years we've known each other. I presently am a nurse practitioner at East Carolina University College of Nursing, and then I do clinical 1 day a week at Pitt County Health Department. But I serve on and have been on the Edgecombe County Health Advisory Board. I'm charged and the chair of that, as well as vice chair of our Human Services Board in Edgecombe County. So I'm very committed to the health of our people in Edgecombe County and working to address that any way I can. As Mr. Jenkins shared with you, I also lost a family member, but mine was more recently. It was a brother-in-law. So I appreciate the COVID-19 from the standpoint of a professional as well as a personal regard, because I've seen both sides of it. So I look forward to being able to share hopefully some insights into both perspectives of that. So thank you for allowing me this opportunity.
Thank you. And next I'll have Ms. LaChapelle introduce herself.
Hey, I'm Karen LaChapelle. I'm the Public Health Director for Edgecombe County. Been having the honor of the privilege of serving in this position since 2006. But I've been in Edgecombe County since 1993. I started out serving as a health educator here, working with businesses, industries, and churches on promoting healthy lifestyles by going and doing health screenings and in-services for these groups. That was one of the best jobs I had in my life. It was a lot of fun, and I got to meet a lot of people from Edgecombe County during that time. Like I said, I've been the health director since March of 2006, and it's been a privilege to share in that capacity here. I am in my 29th year in public health, hooray. And it is, whoever dreamed there would be a pandemic that we would serve. I thought I was honored to be in public health during 3 major storms, but evidently that wasn't enough for us. So we had to have the pandemic. But I too have lost a sister-in-law to COVID back in October. So my family has also suffered this tragic loss. But it's a pleasure to be here, and I look forward to this conversation.
Thank you. And next we'll have Ms. Doris Stiff introduce herself.
Hi, good evening, everyone. I'm Doris Stiff with the Community Enrichment Organization. And I have condolences to all of you who've lost a loved one. I lost a first cousin and a first cousin's wife to COVID, on this Saturday, 2021. Over the years since I've been back in Tarboro since 1993, I've worked with the Community Enrichment Organization. One of their programs, we serve 100 senior citizens with a unity breakfast every month. And we haven't seen them since February of 2020 because of the pandemic. And so I've really felt bad about that there's no way to really gather people together. And that was the whole thing of the unity breakfast, was bringing them together, over 100 of them on a monthly basis. Right now, we still have a grant called Young Visionaries for Health that we've been working with. In spite of COVID, we've been able to do the technology of Zoom like we're using today to continue to see them. And just to get the perspective and the view of the youth for community health and going through a pandemic. So that has been enlightening as well.
Thank you, Ms. Smith. Next, I'll have Kyle Johnson introduce himself.
Hello, everyone. My name is Kyle Johnson, and I serve as one of the associate pastors at Word Tabernacle Church in Rocky Mount, North Carolina. I'm a former teacher in Edgecombe County, but I moved to Rocky Mount when I was 13, and I have fallen in love with this community. And so I have the pleasure of serving our Next Generation ministries, which include the populations birth through 29 years old, along with all the programming. I also do a lot of community partnerships. And as a church member, a community member, and a church representative, COVID has impacted us in many, many ways. I unfortunately have had about 5 people who are connected to my family, whether it be direct members or close people who have passed away because of COVID and complications thereof. And as a church, so far we have had 1 member who passed away, who actually worked at Tabernacle High School with Mr. Jenkins. She passed away from COVID as well, and an impactful and amazing woman who was here for our community and investing in people. But we are here at our church, working our very best to partner with many different organizations and people like Kimberly, who are here to help out with advancing vaccinations and healthy decision making.
Thank you. And last but definitely not least, I'll have Dr. Coward introduce herself.
Hi, my name is Karen Coward. I'm a family physician in Tabernacle. I practice at Vidant Multi-Specialty Clinic Tabernacle, where I also serve as the regional medical director for our Vidant Edgecombe market. So just listening to the introduction just gives us a reason that we're here today. Definitely being a family doctor and seeing any and everybody, this has really been something that has touched everyone from, staff to family, nursing homes. And so definitely want to, offer whatever I can. I think that only God is going to intervene with this. But in the meantime, he also gave us the wisdom of folks who've come up with the vaccine, and we get a chance to talk about some of those things and the effects of the pandemic tonight.
Thank you, Dr. Coward. So I just want to say again, thank you for all of the speakers or the panelists that have joined us tonight. As you all can see, they have a wealth of knowledge that they'll be able to share with us. And what I also identified with all those introductions was the common theme there of how much COVID-19 has just shifted our lives in terms of us having individuals that may have contracted COVID, that may have passed away from this, shifted in the way that we work and do things. So I think that's probably the perfect place to start the conversation, and just thinking a little bit more about the impact of the pandemic over time. So I'm going to start actually with Dr. Coward and have you talk a little bit about how COVID-19 shifted the way you provided care to your patients.
Okay, thank you, Kimberly. I think just the first thing that comes to mind is just the anxiety of everyone around. So not only the patients coming in for care, if they decided to come in at all, but also the staff and just every day just talking about what we needed to do to take care of the patient, which was quite different. All of a sudden everyone has to be screened before they come in. And so it wasn't very welcoming all of a sudden. And that's not something that we want to project, but that we have to, during this time of a pandemic. So, the anxiety for everybody, for those who decided not to come in, who really needed to come to see the doctors in the outpatient setting, or either to go to the emergency room or the hospital. Have a patient that I know had a stroke and refused to go and still refuses to go out. And that's unfortunate that, folks have delayed care because of this. And then we're going to see those consequences for sure down the road. It has opened up virtual care, which is something that was available. And so now it's opened up. Insurance companies decided they're going to allow patients to do that more than they ever did, or telephone, which was important for our area because a lot of patients were unable to connect by video. So it did offer that opportunity to continue to connect with them, and for us to find ways to touch base with them, whatever that meant and whatever they needed. So this has been really interesting, and it continues to be. But I do think that in the long run, we've found new ways for connection that will continue, and it's forced us to do that. So the other thing is that our roles have changed a little bit. So, we have to use the same staff to still screen people at the door, give the vaccines. And so things get undone, or it's later at night, I think, or later in the day when they get done. And so despite that, I don't think most folks have complained because, this is important, lives are at stake. And so everybody has so willingly taken on whatever challenge there was. And so, from a Vidant health level as well, so whatever roles as a regional medical director, coming up with the policies that we need to put in place, again, has just been something just kind of pulling you away from the day-to-day patient care. But basically that whatever it takes attitude and getting things done. And this may, really be a model for the future. As bad as a pandemic is, and as so many lives that were lost, that we'll find the good in the midst of this sorrow that has gone on over these last 14 months or so.
So I know one of the aspects that you highlighted there is that access to care has shifted a bit, and now virtual options have become more commonplace. People are finding that, for, I guess, non-serious or critical issues, they can still connect with the physician and still get, great level of service there. But I know that that virtual aspect wasn't only within healthcare, but also in other areas of our lives as well. And I know two of those areas were education and also the way we gather as a community to worship and fellowship and those types of things. So I wanted to ask Mr. Jenkins if he could speak a little bit about how COVID-19 has shifted the way we provide instruction to our students.
So, and thank you for the question. And also, again, just to reiterate, thanks again for the opportunity just to kind of speak on this behalf. And education is such a broad it's such a broad topic. And I think that when you look at how COVID has impacted like education and how we offer education, I mean, you have to look through so many different lenses. Like we can look through a tangible lens of just like how we educate, right? From the moment of the pandemic, back in March of 2020, honestly, we thought we were just going to be home for 2 weeks and come back and finish off the school year. And truth of the matter is we have kids who have not entered the school building since March of 2020. Yes, because of stipulations that have been handed down from state level and some of the autonomy that the state has given local LEAs, we do have some kids in the building. But truth of the matter is we have a lot of students who have not had traditional face-to-face education in now over a year. And so how that has affected education is we've had to kind of rely solely on just one means of providing education up until the point that we had the autonomy to bring kids back. And so you basically kind of just said, hey, we're going to educate through this virtual platform. And of course, that in itself sounds, realistic and sounds reasonable. You got to keep in mind that, there's that doesn't necessarily address all students and their learning styles. B, what about the students who live in rural parts of the county where, high-speed Wi-Fi is not so accessible? And so it really, it starts with a medical issue, and it turns into a matter of equity. In terms of do all students have accessibility to learning? Do all students have accessibility to the best education provided? And so I think that and I hope I speak for all educators, that I'm sure that every school leader has tried to figure out and troubleshoot, how do we provide the best equitable opportunity and the best education for all of our students, even in the midst of a pandemic? And honestly, I don't know if anyone has come up with a solution that has impacted everyone. And so from an education perspective, as we continue through this process, I believe that we're still missing kids. I think that there's still kids that we're losing through the cracks because of we don't have an equitable opportunity to provide every child with that access and with the education that they need. And so, of course, the counter argument is, okay, well, if that's not working for your children, then why don't you bring them back to school? Well, when accessibility, I heard Dr. Coward talk about access. And so right now, even though right now I think we're going through all the channels where people have access, but truthfully, all of our children and families have not had access yet to the vaccine. And so it creates this dichotomy of an argument of, do you pressure parents to send their children back during a pandemic where they don't have a vaccination that will keep them safe? Or you downplay parents who won't send their children back because they've chosen not to have the vaccine because of a lack of knowledge and lack of informing decisions. And so it's been a tough, I think it's been tough for schools. It's been tough for kids. It's been tough for everybody, to be honest. But it has had a major impact on education. And if I could add a positive, the positive is it's forced us to reimagine education, right? It's forced us to realize that we had some loopholes and some inequities in education all along, and it has taken this pandemic to expose some of those. And so just this idea or this future, where does education go from here? Is this a time where we begin to think about virtual academies and virtual schools, which creates that equitable choice, adds more choice for families to figure out what education style or system works best for my kid?
Thank you. You touched on so much there that I think applies across so many realms of our discussion today. But I think the key thing there is the pandemic really highlighting the health inequities that are present among various communities, and also the matter of equity within education as well. And how do we figure out to make sure all of our students one, are safe, but also are getting the same level and quality of education throughout this time. So we're definitely going to revisit that as we talk a little bit more about moving forward in the future of education. But I actually wanted to ask Ms. Corbett, because I feel like you have ties to both of these areas, being that you teach at East Carolina University and also a nurse practitioner. Just wondering if you had any additional thoughts on how that has impacted you in both of your roles.
I think to echo what Dr. Coward said, as well as Mr. Jenkins, it's certainly opened doors that we did not know that were open. And we can talk about the accessibility of virtual schools and virtual healthcare, but both of them have alluded to Edgecombe County does not have the infrastructure that we need for internet. It's not a matter of ethnicity here as much as being rural. So it's just not available in Edgecombe County. So we did a lot of, and I think Dr. Coward can echo this again, we did a great deal of, rather than virtual healthcare via computer, what we actually did was we did healthcare via telephone. And sometimes we were FaceTiming to be able to do that, trying to provide the best care possible. For education with our students, I teach at the graduate level and some at the undergraduate level. Basically, it was, but again, the problem we ran into was it was via telephone, or students lack that accessibility to the internet. So it did make it problematic, and we had to be very flexible as well as understanding. It wasn't a matter of, you can look at someone's skin, and if I'm face to face with them, I can see it very clearly. But sometimes, as I think Dr. Coward would speak, we were looking at it via FaceTime on a telephone. It's not quite the same, but you make an educated, reasonable diagnosis based upon what you can see with that patient, because you want to provide the best care for them while keeping them safe. You want to provide, as Mr. Jenkins is saying, provide the best education you can for those students, whether they're elementary, high school, or college age, and keeping them safe. One of the problems that we ran into in Edgecombe Community College, I'm sure had the same issue that we had at the university, is, so many of our people were RNs that were working in the pandemic. So they were trying to go to school as well as work and homeschool children. It's not possible. It's just not possible to be able to do that. So people were really taxed. So there's a lot of forgiveness going on. Let us work with you. Let's look at how you can continue to stay in our program. We want to maintain our quality, but we also want to be realistic about what you can do. If you need to drop back this semester, if we need to work with you on these assignments, that's part of what we were trying to do. The same thing for patients. If they would come in, that was wonderful. But if they were not comfortable coming in, how can we best meet your healthcare needs with the limitations that we have? So truly, we were trying to be as flexible as possible. As been spoken to before, I really think the pandemic has had a positive and negative. What are the things that we value during the pandemic? What have we learned? And to me, it's like Charles Dickens. It's the best of times and the worst of times. So let's find what has been the best of these times, learn from those, and then be able to apply those in other situations. Because we're now in it 14 plus months, and it looks like we're going to be out soon. But what lessons have we learned that we can take with us to continue on and to make better? As Dr. Howard said, virtual healthcare will be one of those things because insurance companies are now funding it. So I'm excited about the potential, what we've learned, and I want to learn from it and then apply that for future endeavors.
Thank you, Ms. Corbett. So we talked a little bit about the impact that it's had on individuals receiving care. We've talked a little bit about the impact it's had related to access to education. Now I want to talk a little bit about what the numbers are related to Edgecombe County in terms of the number of COVID-19 cases that we've experienced, as well as how many people we've lost from this terrible virus. So I will have Ms. LaChapelle share a little bit more about that. And then I think we could also start to transition a little bit into talking about, as Ms. Corbett alluded to, kind of the light at the end of the tunnel with the vaccine being available, what types of opportunities that provides us to not necessarily return to normal, but make those adjustments so we can navigate and pivot as much as possible in a healthier space. So I'm going to turn the conversation over to Ms. LaChapelle.
These numbers that I'm going to talk with you about are from May 3rd. It's the latest one that I have gotten from the state, the Department of Health and Human Services. As of May the 3rd, we've had 5,499 cases in Edgecombe County. Of those, the biggest group of people that have had them or the age has had COVID is the age of 25 to 49 years of age, which totals 2,016 of those cases. And when I look at it, when I get these numbers every couple of weeks or so, I look at how much each age group has increased. And not only are they the group with the most cases of COVID, they're also the group with the biggest increase. The interesting thing is from 65 and up, those cases have increased really slow. I think from 65 to 74, we only had 3 new cases the last couple of weeks. And in 75 plus, we've only had 1. So what does that tell us? That tells us that the majority of people that we vaccinated here at the health department, which is over 15,000, and most of those have been 65 and older. So it is telling us that the vaccine is working. Also, in looking at our numbers, we have more females that have had COVID than males. Why is that? I don't know. And in Edgecombe County, we've had more whites that have had COVID than blacks. Whites have been 2,165. Black and brown people, or African Americans, we've had 2,080. We've had 390 hospitalizations. And what's good about that, from the last time I got this report, we've only had 1 admission to the hospital. Now, this is from May the 3rd, so there may be some things in there that are different. Now, the deaths that I have are to date. They are what we have. What Raleigh would tell you that we have 111, but we actually have had 116 deaths. Of those 116, 52 of those came from long-term care facilities. And I'd like to stop here a minute and talk about what a wonderful job our long-term care facilities did during the time they were having such an outbreak in their facilities. You know, a lot of it could have been a lot worse, and every death was too many, but they did a really good job protecting their patients. Of the individuals who have died, the age group with the most, and what we would expect, is 75 plus. They made up 63 of those, which is 54%. Male and female, we're equal, 50-50 number of deaths. We've had 52 Black and brown people pass away from COVID, and 61 whites and 3 other that have died from COVID. And when we look at vaccine, like I said, the health department has given over 15,000 vaccine. Wish I could say all 15,000 of those were Edgecombe County residents, but we've had them from all over everywhere. We've had them from as far as Maryland come in, and most health departments have had them from all over everywhere, because our philosophy was, even though I don't know that it was the right thing to do, but even though anybody that came to our health department that wanted a vaccine, we tried to make sure that they got that vaccine. And just let me stop and digress 1 minute. During the time we were so busy from January and February, just so you know, we did try to call everybody back. Our phone system got backed up. It went down every other day. So we did get behind, but we did. If we didn't call them back, we shared our list with our sister agencies, and they helped us catch those lists up. But everybody, I hope, I'm being very positive in saying everybody, but I hope the majority of people did get a call back from us or either one of our sister agencies to get a COVID vaccine. But in Edgecombe County, 25,370 individuals have had a first and second dose of vaccine. Of that, first doses, 27% have been vaccinated just once, received 1 vaccine, and 11,696, which is 23%, have been fully vaccinated. Is that enough? No. But the thing I will say, if anybody in Edgecombe County wants a vaccine, pretty much any day of the week, it's available. We have had to reduce, we were given our vaccine Monday through Friday from 9 to 4. Several of the drugstores and Freedom Hill were giving it on Saturdays and other days, you know, of the week also. But if anybody wants to get a vaccine in Edgecombe County, it's available. And Mr. Jenkins, I would love to talk with you about doing outreach for us and helping us with outreach, and where you feel that people aren't being reached, because that's how I get my information, is from people who are in the community. That would be awesome. Let's see, what else did I have? We've been working with Freedom Hill, which to make sure that as migrants come in, they're vaccinated. They've been handling that for us. And we have a wide array of agencies that are giving vaccine now. The first couple of months, it was us and Freedom Hill. And then we got OIC on board. And that was not to their fault that they were late getting on board. You just had to be approved by Raleigh to get aboard. But we've got Freedom Hill that gives vaccine, OIC Medical Center, OIC Specialty Care, Pine Tops Pharmacy, Rural Health Group out of Whitaker's, Vidant Multi-Specialty Clinic, Thorn Drugs, and Brown Drugs is on the list, but I'm not sure if they're giving it yet or not. Walgreens and Walmart are also giving it. And we are also working with churches and industry and businesses to go out there and do their vaccine. And we're also working with Edgecombe Rescue Squad to go to homebound patients. We've done a bunch of homebound patients. Anyone that has to be transported to their doctor's appointment by Rescue Squad, we have tried to contact them or they've contacted us, and we've been to their home to give those vaccine. And we've worked with Michelle Cherry and the Rural Health Network to provide services to local churches. And we've also worked with Thorn Drugs to do that also. So, and then the other thing that I can't hush until I mention them is we've had about 14 National Guard soldiers here helping us and marketing and helping us in the clinics. Because if any of you've worked a clinic, and Dr. Corbett worked clinics with us, it's a big undertaking, and we tried really hard in Edgecombe County. And one of the reasons we had so many people coming in from other counties was because we tried to make your wait as short as possible. And I think our average wait time during the height of giving the vaccine was less than 30 minutes. And 15 of that was recovery. And I think our staff, your public health staff, did an awesome job doing that.
Thank you, Ms. LaChapelle. So there were several things that you mentioned there that I wanted to touch base on. One being you just bringing or calling to attention that those that have been vaccinated, at least from the data that you shared, have had, less cases. And those that are the older adults who were some of the first individuals to be vaccinated, there were less cases there. But one interesting thing that you mentioned there that was that out of the data that you had, that less Black and Brown communities were impacted by COVID-19, which is, kind of the opposite of some of like the national data there. And I'm wondering if it's related to one of the points that that Dr. Coward brought up related to many individuals opting not to get care during this time. So I don't know if some Black and Brown communities just decided during this time period that, I'm not going to go to the doctor, meaning that those numbers weren't reported, they weren't tested, or just having, less ability to get that care. So I didn't know if Dr. Coward or Ms. Corbett wanted to talk a little bit about that. That was just an interesting point that I wanted us to talk through. So.
I'm really not sure of the answer to that. You're exactly right that there are a lot of folks who really did stay in, but we also know that folks stayed in contracted COVID. So unless they were completely on lockdown and lived by themselves and allowed no one in their homes. So I think that we'll find out some of those things in the future, but I don't have a good response for that.
One thing that we did do, we got help from, it's called OptumServe. They were a group that was hired by the state to help us out with testing. And we did place, they asked us where the best place for those individuals to be. And they still are at Heritage Park in Princeville, and then also behind the town hall in Pine Tops. And we didn't place one in Rocky Mount because one, we didn't have an option, but OIC at that time was still doing a lot of testing. So that's why we didn't place one in Rocky Mount.
So before I shift to a much needed topic first to address related to the ability to gain access to the vaccination and partnering with local churches. I'm gonna call on Mr. Johnson to talk more about some of the things that his church has done to make sure that their congregation as well as community members have access to the vaccination. I wanted to bring Ms. Stith into the conversation just because as we're talking about the vaccine, we've already kind of shifted to like, we know this number of people have already gotten it in Edgecombe. We already established that there's still not enough individuals that have gotten the vaccine. But we haven't really addressed like the hesitancy part around that and what may be leading to us not having enough individuals vaccinated at this point. We've been trying to follow all of the guidance that are coming out as best as possible. But it's hard to navigate and hard to know, what to believe. So I just wanted her to share a little bit more about her personal story related to her own decision to get the vaccination. I think it's very similar to what I shared earlier from moving from a place of, I don't really know about this, to then building more confidence around that. So I'm gonna allow her to talk a little bit more about that. Oh, I'm having a little bit of trouble hearing you. I think you're still on mute, maybe.
Okay, how about now?
Good to go.
Okay. I don't know what I got on mute. Anyway, I wanted to share also at the beginning when you wondered if Brian Drugs had done any vaccinations. I took my sister to Brian Drugs. So yeah, they got engaged in the vaccinating. And also I took a friend to the clinic and we were in and out in record time. They had that, it was a precision of the machine was working very well. Lots of turnout, but no one was in there longer than 10 or 15 minutes. So the system is working well in terms of having a lot of places that people could get a vaccination and people not having to wait a long time. Now, I was one of those doubters in the beginning, back in March of last year when they started talking about it and everything. And I was like, I don't know about all of this pandemic and all of that, and a vaccination. And all of a sudden, I revisited the whole Tuskegee thing. And I'm like, I don't want to rush into something that's going to have a negative story at the end. So I was a naysayer. And I even put on Facebook about, no, I'm not going to get it. And I don't want to get it until I see all the doctors vaccinated and everything. And then come forward into January, February, when they started saying the vaccination had been developed, released for public consumption. By March, I was having these, okay. And then all of a sudden I'm like, I'm gonna get that vaccination. And now I have to undo my public response. And I need to let folks know that I'm no longer a naysayer. So when I got my vaccination, I took a picture of getting the shot using my cell phone because, they didn't want to do it because of regulations. But I'm like, can I just take my own picture? And I did that and put it on Facebook because I needed to undo the negativity that I had started promoting last year. And then my niece was part of the trial study for the Johnson & Johnson. And that's the one I wanted because I'd been following all of the public information, and I knew that the other two had concerns for people who have a history of allergies. And I've had a history of allergies since I was born. And so I wanted the Johnson & Johnson for that reason, and I got it. and I've had no negative reactions from it, and I've been promoting it. And I was sort of disappointed that they said there was blood clots, but that was okay because it was only 5 out of millions of people. And so I'm always trying to teach on the development of research. I love science. I advocate for science. I wanted to be a doctor, so Dr. Coward, I'm always pushing medical and what have you. And I'm always telling the students and everything, get the shot. But there's still a lot of doubt out there. And I'm trying to promote even more about the vaccination works. We've had very good information on it. The only thing I would say in terms of the public health is that I wish more people had talked to us from March 2020 to January, and educated us more, because people were asking me things, but I knew I didn't have any knowledge, and I didn't want to start writing the Doris textbook about the pandemic. I wanted them to get the right information, so I relied on only what came from public health and CDC in terms of if I repeated anything. Mainly, I referred people to the sources.
Thank you. Thank you. So from what you share, I'm hearing multiple different things. One, you shifted from looking at, like, I guess, historically, some of the things that have been done, unethically related to the studying of Black and Brown communities, and that really kind of shaping your thought process around that. But you identifying, one, accurate information through trusted sources to make a better decision. You identifying someone that you had a personal connection to that you could trust, that you were able to see how your niece was able to respond from her participation in the trial. And you did your due diligence, because you went back from bad mouthing the vaccination and now saying, I've gotten it, I'm good to go, I don't have any effects from it. So yes, being a true advocate there. So thank you so much for sharing your story related to that. Before I switch, and Kyle, I'll get to you in just a second. Before I switch to the access piece, I just wanted to see if Dr. Coward or Ms. LaChapelle or Ms. Corbett had any additional guidance for individuals if they're on the fence about getting the vaccine. What would you like to share with them? What are some of the key considerations they should be thinking about, especially as Ms. Stith had already shared that, some of the hesitancy around this is because, maybe they were banking on just getting the Johnson & Johnson one shot. And then when the news came out about the small group of people that had those effects, they may have, changed their mind about that. It could be they just overall are, resistant to vaccines in general. So I'm just wondering from you three, what would you tell someone who is on the fence? What should they consider? And what are the key benefits related to getting a vaccination?
I could start. One of the things that we felt was important when we started our vaccine clinics way back in January, which seems like a really long time ago now, was when we set up our clinics, we made sure that we were using public health nurses, and that each appointment, this sounds like a lot of time to give a person to just get an injection, we made each appointment 30 minutes long, so that each person that came in, whether they got it or not, and so many came in who made an appointment and said, I just need to talk, and they had 30 minutes or however long they needed to talk with a registered nurse. And Dr. Winslow, our clinician, was on site, and we had Dr. Corbett here who was on site, and a couple of other doctors from the community came and gave vaccine to us, so that people had the opportunity to talk to someone who was really knowledgeable about the vaccine. And I think that helped a lot. Now, did everybody that sit in the chair at the Edgecombe County Health Department get a vaccine? No. Some of them decided they would wait. Did most of them come back? eventually, and came back and got a vaccine. But that was something we did here that I felt was important, that it was more than just putting a shot in the arm. People needed to know.
I think one of the things that I've done, and I had the opportunity to work in Edgecombe County, and I was very grateful for that, as well as Pitt County and at East Carolina, in helping give vaccines as well as counsel people. But I had a number of people, older people as well as other ages, say, I'm not sure whether I want to get this injection. Should I do this? And I'm like, that's not the decision I can make for you. You have to make this decision. But let me share with you the reason I want you to consider strong. I don't know who is going to get COVID. I don't know who's going to end up on a ventilator. We have no guarantees about who's going to get sick and who will not get sick. But we have seen, and our healthcare research is telling us, that people that get the vaccine are doing better and less likely to get COVID than those that do not. That I can support. Are there side effects? Yes. But as Dr. Coward and any of us know, there's side effects to any medication or anything we do. A baby aspirin, people can be allergic to. Do people die from the vaccine? Yes. I'm sorry to say that. And one death is too many. I will certainly agree with that. But the risk of death is less with the vaccine than it is with COVID. So I've got to support that. The evidence tells me to support that. But again, it is your decision to make. I support whatever decision. If you want to go back and think about it, please know I support that. But if you're asking me what I would tell you, if you're my family member, I encourage my family member to get the vaccine. I made appointments for them. And I did that because I love them and I care about them and I want them to be safe. And I'm sure your family would say the same to you. But again, it's your decision. So that's part of how I approached it. Was we don't have good answers, but what the evidence is telling me is this.
So definitely I agree with Ms. Corbett and Ms. LaChapelle. Just asking the questions and not having ideas or thoughts about it that are really not based on evidence and science. And so that's really what I found a lot of for those who said no initially, because they had listened to others that weren't experts on the situation and with vaccines. And so having that informed decision, as Robin said, doesn't matter what it is, but as long as you have the truth and not what others have said or some anecdotal things of reactions or any other reason, which does not have a lot of weight in terms of the potential hospitalization and death associated with getting COVID. And, you know, everyone walking around had that, you know, could be someone who has COVID because most folks were asymptomatic. So it's just talking and probably for me more one-on-one and just answering the questions, listening to their concerns and validating them or saying, well, here's the science behind it.
So I heard a theme there of trusting the science and doing your research there, but also having conversations with individuals as well. I just want to say, you know, kudos to the Edgecombe County Health Department for allotting that extra amount of time for people to come in and ask those questions and really be educated on, you know, what exactly they may experience with the vaccine, you know, what are the key benefits. I think just having that time reserved for a conversation makes a lot of difference, you know, from a trusted, you know, hearing from a trusted health professional. So obviously rely on all the information that you got from our health professionals, but I just wanted to kind of echo that in terms of my personal reflections and stories related to that. And I mentioned that I was able to get, very accurate, up-to-date information, partly due because of where I work, but me doing my own research as well, be asking questions, taking a similar approach as what Ms. Stith mentioned, where if I had friends and family who had already got the vaccination, I was able to ask them questions and learn a little bit more about what they were experiencing. And for me, as someone who is I would say a COVID survivor myself, for me, it was like a pros and cons thing, as each of you laid out, just looking at the risk associated if I did not get the vaccination, me potentially, potentially passing away if I didn't get the vaccine versus, if I do get the vaccination, I have that greater level of protection there. So I do want to invite Mr. Johnson to talk a little bit about one of the things that Ms. LaChapelle alluded to earlier related to the church and their involvement with educating the community and providing them with a greater level of access to the vaccine. I know you've shared with me personally some of the things that your church have done. So just sharing a little bit about that. And then around the hesitancy piece, with some of the efforts that your church has been doing, if you have any additional insight on where some of that resistance is coming from some of your either congregation or community members that you've been working with.
So, hey y'all, all these amazing medical professionals. I have loved hearing your stories and your insight. And one thing that I have learned through being a church member, by working at the church, and being a community member, is just seeing how tied together we all are. And I think that it's really imperative. As a former teacher, I learned the difference of the separation of church and state, and how important that is. But we cannot separate the church and community in any capacity, because the church is the community and the community is the church. And here at Word, we have a whole philosophy model that everyone in the community doesn't belong to the church, but the church itself belongs to everyone in the community. And so throughout the years, as we have done partnerships with different organizations, and just learning all the ways that we kind of, coincide with our like mission of making sure that community members and entities are thriving, we have just been able to utilize a lot of those skill sets throughout the things that we've learned throughout this time in COVID. And so when it comes to like faith leaders, when it comes to the church, we are a trusted organization by the members. Step part one. And here at Word, we have about like 3,000 members. And so the impact and the influence that we have in view of being able to accurately educate people on things, and being able to accurately, as much as possible, help people make those informed decisions. Like, we have a huge responsibility. And that even impacted, the way that we decided. I mean, there were government mandates about gathering as well. But then also just making sure that we aligned with them and that we stood by them. And we have traditionally throughout this COVID season taken, a higher standard when it came to gathering, because we want to be careful, even when it comes down to, getting 2,000 people in a room in the midst of a pandemic, and then sending them out. That's not being a good steward of the souls of the people that we've trusted and been entrusted to by God. But it's also not being a good steward of our community, because we don't know what exposures can happen in that time frame. And so it has been an interesting transition, having to learn how to function and to do things. But some of the things that we've been able to really work with is realizing that, when it comes down to the church and gathering, it's not just about getting together, but it's also about the mental health. It's also about the holistic dynamics that come into a person, the social community that essentially came to a quick halt at one moment, because it's not just Sundays, but then your small groups and your interactions. And then the mental health ramifications of all of that, the spiritual health ramifications of all of that. And so what we've been really trying to do is make sure that we are able to provide and engage in membership and the community to help them navigate those dynamics for themselves, while we're also doing it collectively. And so we have been doing vaccine clinics and partnerships with many different organizations, including our local healthcare system, as well as partnering with state things like UNC School of Yale Public Health. We've been doing partnership with them, and a partnership with some people from Kentucky came to Rocky Mount to study what's going on in the Twin Counties. And so we have been able to do 6 clinics And in those 6 vaccination clinics thus far, we've been able to vaccinate approximately 979 people. And when I say we, please know that it is like, while we do have wordites who in our medical ministry team, like who are nurses who are doing it, when I say we, I mean collectively as a community, through this one site, we have been able to vaccinate 979 people. And that has been partnerships with Pfizer, partnerships with, like I said, the different health entities and things here, but also partnerships with lots of different organizations. And so while we would, do the first shot dose, someone else may host the second shot dose and vice versa. But then also just making sure that we're utilizing our chain of commands in our systems. We have text messaging for all of our members. We have phone calls that we can send out, automated phone calls to inform and educate. Our Center for Media and Broadcast has been doing PSAs and things like that. And so our deal was to utilize all the systems that we already have in place that can easily inform and empower people, but then also build new partnerships. And so in the same way that on Sunday morning, we used to gather in one room, we've been gathering online, only online. And so if we can shift how we do Sunday morning with all those working parts, why not be able to shift how we also do other partnerships and reaching out to community? And one of the things I think is interesting, and I love all of the conversation about even the what's oftentimes marginalized populations, and how oftentimes when it comes to everything from healthcare to information and education, those marginalized populations don't always have an equitable access. And so making sure that, because we have the church is made up of individuals who are then put into communities, really leaning on membership to help reach their neighbors, to inform their neighbors, and to let their neighbors know about what's possible. And so at one of our vaccine clinics, in terms of the hesitancy, one of the things that we saw was that it wasn't necessary, because I would ask people, so what are you thinking about this? And I'm talking to them in my role as a friend. I'm also talking to them as an associate pastor. I'm talking to them as a leader. And so they were very honest and blunt. Some of them said, I just don't trust it because of the history that has gone on with the healthcare system. Some people said it just seems like it was too fast, that the vaccine was made so fast. Some people said, I just really don't like needles and I'm not getting stuck in the arm. And so there was, of course, so much shared from so many different perspectives, but gleaning from all of our members and the people that we're talking to, and we do surveys, and we sent out surveys, and there was about 2,000 people who responded to that survey, and they gave us information about what is their hesitancy. And so we're able then to create programming that specifically meets those needs. And so while they may not take a random text message that comes from North Carolina Health and Human Services because they don't know that phone number, they may not answer the phone call from the health department, unfortunately. They may not go to the hospital, but they know I've already been connected to this church. And so I'll take this quick survey from Pastor Kyle, and I'll do this. And so really leaning in onto relationships and honoring trust, not taking advantage of it, but really honoring it. And that's one of the reasons why even in our communications and education information, we really do lean in on the experts. We lean in on the science, just because, like with everything else, we don't believe that faith and science are in competition. They're very much so compatible. And so we lean into helping people understand that they can trust the systems, they can trust the entities that are out there. And hopefully, as I think an outcome of all of this is that there'll be more education, not just about with vaccines, but then also other spaces in healthcare, other spaces in community, and other bridges that are being built from it.
So Kyle, you dropped so many gems there. And I appreciate everything that you just provided us there, from how your church was able to shift in the way that you were able to bring your members together to worship and still have that opportunity to gather in a different way, to some of the community partnerships you built for these vaccination clinics, and just the emphasis on developing relationships and the power of that. And I feel like that's a continuous theme that we're hearing throughout this time. I know one of the aspects that you mentioned in terms of what you've learned from talking with some of your members and sending out that survey was, some people had concerns around the length of time in which the vaccine was created. And that was actually a question that was included in our Q&A tab today as well, just in terms of, I don't know if I could trust this just because of the speed in which the vaccine was created. So I don't know if any of our panelists wanted to address that and just, instilling a little bit more faith around that area.
Well, what I responded to people is this is the coronavirus. Corona has been around for years. So scientists have had the opportunity to do lots of research, gather information, and use that knowledge to improve their ability to treat and eliminate corona. So I always look at it because I used to work for a research scientist. I know that by the time he got his confirmation on ultraviolet light and ozonation, he done 17 years of research. So these scientists who were brought up, who have been studying corona, and COVID is the 19th one. So they studied 18 before 19. We have to, and I tell people all the time, you've got to honor the work, the research, and the knowledge that happened before COVID-19. So I just ask people, honor other people's work is one thing you have to do. And another thing is trust that everyone is not here to do harm.
Yeah, and one thing that I have really leaned into as I listen to like lots of podcasts and panelists and just learn and read and listen to genius doctors and scientists is to realize that the process of getting something approved by the CDC, the process of creating vaccinations, the process of making medicine, oftentimes it is not something that is done within a year, but it comes down with lots of base information. And so I know that even with the vaccine, the way that the different vaccines work in training cells to create defenses and to how to work against the virus, I try to break it down as simple as chicken sandwiches. So I'm sure there was like a craze for Popeye's chicken sandwiches, right? And everyone loved it, everyone wanted to get it. But Zaxby's was behind the curve, and they have like a whole chicken like restaurant, but they were making their chicken sandwiches with chicken tenders. And then they tried the TLC and it didn't work out well. But then they went back and they tried it again, and they have like what is now something that is, viable and comparable to other restaurants that have it. But the dynamic is like it all comes with base information. And it wasn't, as Ms. This said, it's not that they went into the lab and all of a sudden said, hey, today, let's start working on this. It's a respiratory virus. It's a virus that affects this type of part of the body, that part of the body. And there's information on how to create vaccines. And I'm sure the doctors here can talk much better about the technical side of this. But when I'm talking to like different community members, oftentimes when I start digging deep into the science stuff, they're like, I don't understand all those dynamics. And so I just tell them there's base foundation. And when this particular virus came about, scientists and researchers and doctors started to do more research on how to then take these basic information things and then figure out something to work against this. And so it's not that they all of a sudden came from zero. They have been working with different chicken sandwiches, and they just found the best one to satisfy the customer as is needed today. And I'm sure in 20 years, there'll be a completely different type of chicken sandwich that the kitchen researchers will figure out how to make to satisfy the customer at that time.
Kyle, I love that analogy. You broke it down.
It really is. I mean, that's the truth, Ms. Smith, as well as Mr. Johnson. I mean, you really have said it. The science was already there. They had some practice with the Ebola virus, but the spike protein was very similar to other things. And another thing is that they had people that were actually volunteering, which usually they didn't get a lot of volunteers when they were making different vaccines, but people were just coming out of the woodwork and just volunteering because this was so important. And so they got a lot of people fast and could do a lot of research on it. But it's just like you all said, it was there. And I think the media helped to put some doubt into some of the, how long would it take and all of these things. And one things that we never thought about before, have we ever thought about how long the other vaccines took? We don't know. We just knew, our doctor told us to take it and it was there. So we have to trust some of the science.
One of the things, and we got a lot of these questions, and y'all have done a really good job, and I love the chicken sandwich thing. But one thing that I underestimated during this time, and how many times this happened, was the fear people have in getting an injection, just getting an injection. I did not realize that many people were afraid of getting a shot. I had more than one person tell the nurse, call Karen LaChapelle, she's going to hold my hand. She got me in here. She's going to hold my hand to get through. And the thing is, I thought they were joking, but they were really afraid. They were really afraid. And that happened more often. I mean, and this is adults than not. It doesn't sound, because I'm not afraid. And I don't, I can't quite understand it, but I see now, and probably Dr. Coward and Dr. Corbett have seen this a lot more than I ever have, because you are clinicians and I'm not. But it really shocked me of how many people were afraid of what they call a needle.
And Ms.
I
LaChapelle,
have one young, excuse me.
go ahead.
I have one young man that told me, I said, you're going to get your vaccination. He said, now, and I forgot. He said, you're going to need 2 people to hold me down and the third one to give me the shot. And it is true. It is true in his history of injections. And I thought, well, I would really have to take him to the clinic. He could not do one of the community sites.
And I've learned that when it comes to hesitancy, things that I had to put aside was my perspective. And that for me, a vaccine that's been tested, it's an option. Of course, I'm going to take it. Like, there's no doubt I'm going to go for this vaccine. And really to honor people's hesitancies, as difficult as it is sometimes for me, to honor what is it that's driving someone to either have a fear. And sometimes the hesitancy isn't a fear, it's still calculation, and but to honor their process because there is their decision, while also helping them see the immediacy of now and how important it is for not only their safety, but for that of the community. And I think that is something that a lot of people are struggling with, because many times people feel pressured to do what's good for the whole without, and in doing so, feeling like people want them to throw away what they feel like is good for them. And so it's this interesting dynamic that we have to do, and that we have to explain, and we have to first understand in order to help people through their hesitancies, if the outcome is going to be best for them and ultimately best for everyone. And the struggle is doing that one at a time, consistently, but not giving up on honoring their hesitation.
Kyle, in contrast to the chicken sandwich, I approached it a little differently. I told them, people don't believe in miracles these days, but I still believe that God has miracles. And I believe it was a miracle that God allowed us to pull that knowledge together to create this vaccine in less than a year. And that in itself is evidence that we need to consider this vaccine for faith-believing people. So it's probably not as good as the chicken sandwich, but I used it.
I think each one of those were great. And agree with each one of the points that you all made related to that. So I know we're coming close on the close of our discussion here, but there were a few other aspects that I wanted to make sure that we tackled. One, I know Ms. LaChapelle already addressed some of this just in terms of her stating that, there are plenty of different options in terms of receiving the vaccination, but just us making sure that if we had any information to share on any upcoming vaccination clinics anywhere, if they wanted to have those conversations about just, answering more of their questions around the vaccine and what that can mean, how would they schedule time with the health professionals, talk through that. But then the other aspect that I believe Ms. Smith alluded to earlier, but I just wanted to make sure we address as well. So we're at the point now, like I said, I feel like we're looking at kind of light at the end of the tunnel. We do have the option of getting the vaccine. We have seen, or we have the evidence that those that have been vaccinated are less likely to contract COVID. We know that there's been new guidance released as of today in terms of how we can now gather and how we can operate at this point. So I just wanted to do a little bit of forecasting here in various different ways on what this means in terms of the future of how our community will function. I wanted to start that conversation with Mr. Jenkins and going a little bit further into how do you feel like this is going to impact education moving forward? And what has been some of the discussions or some of the different questions that your students have asked as they're looking to return to normalcy as much as possible, because I know they've lost a lot over this past year. Their experiences, for their classes and their activities has been way different. So just talking about that and how we can address it and better support them. And then I'll get, insight from other panelists on just future projections and what do you feel like this means moving forward? And we'll go from there. So Mr. Jenkins, if you could share a little bit more your perspective related to that.
Yes, I think one of the major educational debates now is just centered around like just traditional education, like what that trajectory looks like for all kids. You see some counties like Wake County that has, already open enrollment for like a virtual school. I'm very proud to say that even here in Edgecombe County that there's work currently being done right now around designing a virtual academy. For parents who feel that that is the best option, what this has revealed is that some kids have proven that even in the midst of a pandemic, not attending a traditional school has worked for them. And so, that kind of raises questions about like, student autonomy, like voice and choice, like how do students best learn? And if students best learn out of the building, should that be a thing? And what should that look like? And I think that's certainly something that we should for sure entertain, because students go off to college and guess what? Like now, and of course, not for me because I've been out of college for forever, but when I was in college, all of your classes were face-to-face. But now I know kids who are in colleges and they say, hey, well, I have 15 credit hours, but they're all online. I don't go to class, So I think that this new pipeline or this new way of how we do school, I think is important. And I think that it requires a community as well as an educational response. I also think that in terms of like moving forward, and I know some of the concerns that I think that a lot of people have talked about is, of course, quite naturally, like the big debate is like, man, like kids have not had a real face-to-face educational experience, some kids in over a year. And that is a big issue. But what I think is a bigger issue is like, I'm not so concerned about, can we close opportunity gaps? Can we close achievement gaps? Like, I know we can close that. My big concern is, can we close the social and emotional damage, for lack of better terms, that has been done for some of our children? Like some of our children have, just think about what they've seen in the world from March of 2020 to now. And it's not just like, coronavirus and COVID-19. This is inclusive of so many things. And I think a lot of our children have been on such a social and emotional roller coaster that my concern is like, how do we get our kids back? How do we build them back stronger to believe in our schools again, to believe in the community again? How do we help them recover from the trauma of witnessing family members die from COVID-19? Or how do we help comfort them in a way that they don't feel that, am I going to get sick and die? Is my mom and dad going to get sick and die? Like, this is a major crisis. Not just educationally, but socially and emotionally. So my big thing is, yeah, we can catch kids up. I believe wholeheartedly in the teachers who teach in our school systems every day. But how do we help kids recover socially and emotionally from the pandemic? And I don't have an answer for that. I think what it has done for me is it has reminded me of my why. And it has made me realize that when kids are back in my building and when kids are back, it makes me want to love them more. It makes me want to hug them more. It makes me want to, when it's safe to hug again, it just makes me want to like, just love on our kids more and reassure them that, and to add added assurance that like that this is still, so we still believe in you and we still believe in school. For me, it's just this, where do we go next in terms of like this social and emotional piece? Of course, social emotional learning has been one of the major conversations of the day. I'm going to say within this last 2-3 years, I think it's been one of the issues that we've talked about a lot as we've had access to more like research on like brain trauma and things around that nature. So I think those are some of the things that should be talking about. And those conversations, I can't speak for other LEAs and counties, but those are all conversations that we are certainly having here in Edgecombe.
Thank you. That was such an important piece to address, the attending to the mental health of our students, not just, related to COVID-19, but all of the things that we've experienced over the past year, and making sure that we provide a strong level of support to them in different ways. I didn't know if any of our other panelists wanted to kind of speak to that mental health piece, because I know that is critical for our students, but I know us as adults are probably experiencing some of that as well. So either those of you that work with students, if you want to speak a little bit more about that, if you've experienced any of that with your interactions with some of your adult connections as well.
I'll share a little bit just in terms of, from so many areas, that we really need to be prepared about once the vaccination is farther along, but we need to look at all the fallout from this pandemic. We need to look at the grieving. We got a class of 2020 that never got to experience a graduation. We got those coming up and still anticipating how much of a graduation, of prom, all of that. Once again, our young people are missing out on. We even talked to a group of students and we said, if we brought in some speakers, what would you want? What kind of speakers do you want? And we never dropped this word to them or this phrase. They said, could you bring in people who can talk to us about mental health? They recognized that this had affected their ability to cope. And look at these students who've lost the school, the classroom, they lost the prom, they lost graduation. They're seeing their parents at home too, because either they lost a job or the job has been transferred home. So we got all of these changes, all of this fallout. And I wonder, have we started preparation on how to deal with all of that? I belong to a social group. I talked to my girlfriend. She said, Doris, this COVID-itis got me. She said, plus, and like one student said, I have a quarantine weight of 20 extra pounds. So we got the quarantine weight, we got all the changes, and the COVID-itis is the emotional toil of these last 14 months. And as we talk about everybody getting the vaccination, I think somewhere along the line, we need to start preparing to respond. And sometimes we may not have to. A lot of people will be able to cope. but we need to acknowledge the pandemic has brought its own level of trauma to our families and individuals.
That is absolutely, I absolutely agree. And there's so many different levels of it. And I think it's interesting. And I'm glad that you brought up the idea of the COVID weight. I am a part of that group with my 30 extra pounds from COVID. Ooh, y'all. But I've been working that off. Thank God for Lent and fasting and discipline. But one of the things that we've been working to do is to make sure that we are really serving people holistically, and to not just let that be a buzzword. And I think that that's one of the things that's really important for us as a community to have, because we do want people to be physically well. And so, of course, the vaccination can help out with that. And we also want them to be, mentally and emotionally well. So one of the things that we've been able to do with our Center for Counseling here at the church, we have 2 licensed clinical counselors on staff who head up our counseling division. And that includes everything from grief counseling to marriage counseling to just one-on-one therapy and things like that. But even with our Next Generation Ministries, we have been able to partner with local therapists who have offered free counseling to students. And so we have 2 agencies that say if we refer someone to them, that they will take them on as free patients. But we also partner with Project Momentum, who's been doing a lot of work because of the season with COVID. There's lots of grant money that organizations are utilizing, and they are looking for populations to serve. And so that's one of the things that we're leaning into. So while we have the infrastructure here at the church to be able to do those things, we also realize that we want to be a hub where other people can say, I can go to this place for the source, but it's really just pointing them to other community partners. And so for those who are watching on our website, we have nextgen.wordtab.net. Under our resources, we have counseling. And so we offer that out for those who, for what we call our next generation investors, anyone who's serving and investing in that next generation. But it also will link them to people who are able to just talk to a mentor here at the church, because there's different levels of need. And so we have it to where you can talk to an investor, a mentor here at the church. We have it to where you can talk to our counseling division and set up an appointment with one of our counselors and our mental health coaches. Or you can also be referred to and partner with one of those community agencies that I said that they had offered out those opportunities for people as well. And so we set that up so that we set up that web page on the website so that we can be a hub to connect with so many. And I think that the other dynamics in view of like with mental health is a lot of times people don't quite understand what that means. Unfortunately, because of the emphasis of it, I think oftentimes it becomes a buzzword. And people just kind of let it wash off of them, and they don't really realize like the dynamics of what exactly could be a moment where they need to lean into some care and lean into some support so that they can be consistently well. And so I think that as people are exploring what that means, that they need to realize that it's okay not just to seek out therapy and counseling, but it's okay to also just kind of start asking yourself, am I in a space where I need to talk to anybody? I need to talk to a friend about this feeling that I'm having. I need to talk to a trusted family member about what I'm thinking about and things like that. So I think that kind of creating and helping us understand there's different levels and different ways that we need to have care could really be helpful with the mental health dynamic. Because, and I'll point this out as Mr. Jenkins is working in the school system, that we know that oftentimes, especially with the next generation, the teachers, the principals, and the counselors, the coaches are oftentimes the number one person that people feel they can lean into. And then in addition to that, when talking to parents who feel completely overwhelmed by all of the things that are going on with this new way of learning and who feel overwhelmed with work and all that kind of stuff. So oftentimes teachers are the first responders, and teachers are those the people on the front line and people who work in the school are front line to be able to notice things that they can say, hey, I can refer you to this support system. But I also realize that, sometimes entities aren't as trusted. And so we need to make sure that we lean in on those trusted entities and organizations, because they can be the gateway to help people get into resources that they wouldn't go to as a first option.
I just want to appreciate everyone, the teachers that had to do this shift into virtual learning and everything, and all of a sudden just had to know quickly how to do it. To the doctors that had to all of a sudden just shift totally from your typical patient care to virtual care to setting up your whole entry into the clinic. And so I look, when I took a patient, I'm like, oh wow, they had to have 3 people out here in the lobby. I was just looking at the amount of workers that had to be adjusted just for this pandemic. So I'm really appreciating it, Karen. And all of a sudden, you had to become an expert on public health at the national level where they didn't have a national plan. And so I want to just appreciate all of you for making the shift immediately, because that was not, you didn't get a notice to plan. You just got a request that said start now, today. And you did it, you survived it. We've lost some people, but a lot of people have survived. We understand coronavirus. We understand how, as a community, we all have to work together. We all know now about toilet tissue and paper towel and Lysol. So it's been an interesting 14 months. But
I would like to say one thing. Doris, thank you. That was very kind. But in Edgecombe County, and I'm not a native from Edgecombe County, but there's one thing that I know that I have learned about people from Edgecombe County, and I consider myself Edgecombe County now because I've been here longer than I was raised in children. Yeah, Doris, I was thinking it's been 29 years, lady, since we met. But a lot has happened, and I am so thankful for, first of all, the public health staff and Dr. Winslow, who has been magnificent, and also to the medical community. Dr. Coward, y'all been awesome. Vitamin Multi-Specialty Clinic, and Dr. Corbett, you talk with me a lot on the telephone because I will admit to you, it has been very scary. A lot of decisions that we've had to make, but thank the good Lord, I don't make them alone. I've got a whole big crowd of people that helps me make decisions. So I'm very thankful for that, because I get a lot of credit, but it's the whole community.
Yeah, great things for the health department and even the vaccines that have been given at the church. And Miss, that you're always there. And Miss Corbett, all the great things you're doing. I mean, I think when I think about Edgecombe County, and I think for whatever reason, several of us have been here for 29 years, I just think about resilience. So whatever the challenge that comes to us, and of course, we've had a lot of challenges over these last few years, but the community comes together and the community supports each other. And I really thank Kimberly for getting this together, because I think that you just see this, from every aspect, whatever it is. Let's take the challenge, let's see what it is, and let's take care of each other. And that's how we're getting through this.
So yes, I want to say thank you to everyone, healthcare providers, the educators, those that well, really all of us should be, giving ourselves a pat on the back for surviving this past year and all of the challenges that it has brought. Before we close out tonight, I wanted to address one additional question, and then I'll let everyone say their closing thoughts here. But I feel like it would be a missed opportunity if we didn't talk about the 2 recent recommendations that came out, and what that means moving forward. So I saw recently that the CDC decided that students or youth as young as 12 can now start getting the vaccination. So I don't know if Mr. Jenkins wanted to talk a little bit about that and what that can mean in terms of again, just thinking about education as a whole, how we were able to bring students back into the buildings, or if that's even, as you alluded to earlier, the best method of instruction that's going to be provided to them. And then in addition to that, today's recommendation from the CDC saying that all vaccinated, fully vaccinated people no longer have to wear a mask. So with that second piece, I wanted to start with Dr. Coward to see if you had any additional thoughts related to that, and what should those consider related to this new recommendation as they may interact with maybe someone that's not vaccinated, and like, what does that mean as we're thinking about maybe returning to church or gathering with our family and friends? Just what are some different things that we need to keep in top of mind to make sure we're being diligent about keeping our community safe as a whole?
Well, I think that as we take this next step, I think it's really anxiety provoking for some. We were talking a little bit before we started that we've kind of gotten into this mode, and so had to move with a little bit of hesitancy whenever we're given new information. Is this okay? Is this okay? And again, I think we have to follow the science with it. We're still going to be around folks who haven't been vaccinated, haven't been fully vaccinated, and we really have to think about who we're around that may be vulnerable. I think that's one of the biggest things, and that may be even a reason to consider vaccination, because you want to make sure that those people who are very young and just coming into the world, or those who are very old, that we may impact, and is that going to be okay? But I think this is, moving forward with steps is good, because that was part of why there was a push. Definitely, we don't have that 80% that the CDC talked about to get that herd immunity, but more and more people, even though it's really at a slower pace, are getting vaccinated. And it's conversations like this that I think will encourage folks to do so. But yeah, it's okay, to move forward with the recommendations, and just still be diligent and know your surroundings as you always do.
I hope our phones start ringing off the hooks again for appointments. I think this will encourage people to hopefully become vaccinated. I hope. That's just me. I hope.
That is my hope as well. And then, Mr. Jenkins, I didn't know if you wanted to address the other aspect of that as well.
Yeah, sure. Quickly, I think that I think it's a good idea. Honestly, I think from the very beginning of the pandemic, there were some misconceptions around COVID and its impact on children. And I think one of the biggest conceptions was that children were somehow or another mysteriously immune from COVID-19, and we know that is not the case, as there's been a lot of casualties around our country amongst children. I think that hopefully the accessibility for children to have the vaccine is not just about like, I think it's not so much about just like, just the safety piece. I think it just eases the tension. I think any parent would feel better about sending their child back to school, knowing that A, that they have a vaccine, and B, the children that they're playing with on the playground also has a vaccine. I think the tension from teacher perspectives and leaders is when our kids come to our building, we don't know where they've been. We don't know what they've been exposed to until we get that email or that call saying, hey, LaShawn has been exposed to a family member. And so now from a domino perspective, now that teacher may be at risk, the children that the child came into contact may be at risk. And so it's like, it triggers that anxiety all over again. I know that, and I don't think I've said this, but I know that once I was fully vaccinated as of March the 10th, I think. And it just eased so much anxiety. I still continue to social distance. I still continue to wear my mask, and I'm probably going to continue to wear my mask for the next 3 years because of the trauma that I'm experiencing around like COVID. But I think getting children that vaccination just begins to create, I don't know if we'll ever get back to that place of normalcy, but it will begin to create at least a place of of stability, so that those systems that we had in place, that we can somehow or another, as we begin to redesign some of those systems, so that we can kind of get back into that at least a place of social stability, or at least social mobility, so to speak.
I have one other thing. I hope this has taught people to wash their hands. I think washing your hands is so important. Is that not a public health statement or what?
I know. Look, my grandson came in the last day, well, March 15th or whenever they send the children home. He came right in my house, wrote a sign and put it on my door for everyone who came in, wash your hands. I'm like, okay, the school talked to him before they sent him home. But back to the vaccinations piece for the children, Kim, I think about the fact when I went to school, going back to grade school, and when they were giving out the polio vaccine and everything. And I didn't even think about that until I was in college, or when I ran into my cousin. I met a guy in college that had a limp. And I finally said, you hurt your ankle? He said, no, I had polio as a child. And so I saw that ramification. Then my cousin Romulus, he's walked with crutches all of his life since he had it as a child. And so when I look at the vaccination and the benefit is safety, I see it as a mode of safety for children to be able to be at school and feel comfortable, and for the parents to feel comfortable that they have sent their child back into the pandemic land that we're slowly coming out of. And we don't know what out of is going to fully look like, but we do know the science of the vaccination makes us safer. And I think for children, every parent wants their child to be safe. And so I tell them the story of the polio cases and what a vaccination kept other children from getting polio.
And I'm just really, I know my daughter, my oldest child is 7, about to turn 8. And so she's not in that group of vaccinations. I'm sure that as, time goes on and either, approval extends or new vaccines are made, at some point she will be allowed to get a vaccination. And I think about the fact that she got vaccinations as an infant, and she got vaccinations before she went to kindergarten. And I got vaccinations before I went to college. And vaccinations are their medicine, and it's a part of our normal everyday living. And so I do know that when I send my child outside of my home, I try my very best to protect them. I try my very best to make sure that they are holistically cared for. And so if that includes vaccinations, I'm excited about when it gets to that point. I also realize that as much as people are hesitant about themselves, they were more hesitant and more careful. I'm not going to say hesitant. They're more careful with their children. And so I think that as people use wisdom and as they see that the effects of medicine and science is safety, that they are more likely to lean into that. And as a person who serves the Next Generation Ministries, I look forward to seeing students laughing together and hanging out together without the concern that it could be harmful. I look forward to the parents having complete, not just to the point of saying, hey, I'm going to go ahead and transition because we've been in this too long, but parents sending their children off into the community to live life in different aspects with confidence that their child is going to be okay, or at least protected from these things. And so I know that there's a whole lot that we have to get our heads around, but my hope is that as regulations are shifting for those who have vaccinations, that people would see that I want to be able to shift into that safely. I want to be able to go to church safely. I want to be able to go to the restaurant safely and without the concerns like lulling in my head. And I want my children to not have to carry that burden either. And so I'm excited about it. I am vaccinated, fully vaccinated. I will still be wearing my mask in public, but it is good to know that if I need a break, I can take it off. But I will make sure that I'm doing that, not just for me, but also as a testament to others that, hey, it's okay and good to wear masks, because I realize that there's a lot of social pressure that comes along with that as well. And so I'll gladly keep wearing my mask as I go out and interact with the world.
Mhm.
Thank you all for those thoughts and those two questions. A lot of what you stated resonated with me just in terms of, not having as much anxiety around, gathering with others and parents having a greater level of confidence in interactions with their children and that type of thing. Personal perspective, I know for me, I felt that like the last time that I was able to see my mom and sister, which was recently, I had a greater level of I guess, ease and peace about it because they were both fully vaccinated. I was halfway there. So I was like, I think we're good to go here. So that's a very real thing, especially as we're thinking about how to protect our students. And then the second thing is just looking at all the various vaccines we've taken, throughout the course of our life and trusting those things and how effective they've been. So those were two really great points. I know we went a little bit over time, but this was much needed topics to cover, so I'm okay with that. As we come to a close here, I wanted, if any of the panelists had, a closing thought, I would say a burning closing thought that you wanted to address to wrap up the conversation, feel free to do so now. And then we can shift to my closing and then we'll wrap up for today.
I just want to say that I think a lot of work has been done. And as Ms. Stith had mentioned, we did not have a playbook when we started this game, and we still don't have a playbook. So we're sometimes punting, but as Dr. Coward and others have said, we're trying to follow the evidence and what is science telling us, but there's still more to be learned. And I want to learn that and see how we can apply that to keep all of us safe.
Thank you.
And that's a good thing. All we've learned over the course of these 14 months, so much knowledge. I think that is great.
So it looks like that brings me to my close for today. I wanted to just say, one, thank you to all of the panelists that joined us today. The insight, your expertise, your knowledge that you shared today was wonderful. I learned a lot from our discussion. I'm hoping that those who may have joined today or may view this later, learns a few new things and increases their knowledge about how to better educate themselves and how to gain access to the vaccination. But also, I think a central core theme of the discussion here today was us continuing to form or lean on those relationships and form that community amongst one another to support one another. So I'm hoping we'll be able to do that moving forward. The last thing I'll say is that, again, I wanted this just to be a knowledge sharing, a conversation here about this. I will be, posting a few links to some of the resources that was talked about today when I post the video. So I'm hoping that you all will take advantage of that. And the last thing I'll say is that everyone be safe and well, and thank you for joining us today.
Thank you for doing this. Thank you.